We start considering lung transplantation in the patients with CF when their lung function drops to about 30% of what they're predicted to be. At that time, we know by previous statistics that the survival significantly drops, and it's about 50% at 2 years. And so our results with lung transplantation give much better survival and also give a much better quality of life. Approximately 16% of the patients who've undergone lung transplantation in the world have had cystic fibrosis. We consider cystic fibrosis as one of the end-stage lung disease that most benefit from lung transplantation. The cystic fibrosis involves multiple organs in the body. So the cystic fibrosis is still present in the sinuses, and the stomach, and the rest of the GI tract, and in the sweat glands. But the new lungs have a different genes, and they do not have cystic fibrosis. Patients still have cystic fibrosis, and so they still have to take the various medications to treat diabetes or to treat malabsorption and the vitamins that they need because they can't absorb them, but they no longer need to take all of the respiratory medicines that they were taking prior to the transplant. As we become more experienced and have more knowledge about the complications of cystic fibrosis, we now recognize that there are some conditions that would be better not to transplant than to transplant. In cystic fibrosis patients who have a certain type of organism that's growing in their sputum or in their lung, such as Burkholderia, Cepacia, those patients do not do as well after transplant, and so we tend to not transplant those patients. Cystic fibrosis is a very complex disease that involves multiple organs, and because of that we need a team approach. At Baylor we have that team approach that consists of gastroenterologists, the microbiologist, and the infectious disease specialists, and pulmonologists. But additionally, we need the support people that clearly are the ones that make the difference. And those are the dietitians that spend time to make sure they get proper nutrition, the respiratory therapists who spend time with the patients so they can get the proper equipment to clear the secretions, the social workers so they can understand how to get the benefits so they can afford all of their medicines and the other types of therapy. By and large, we perform lung transplants in the cystic fibrosis patients when their lung function drops to less than 30%, which correlates to about a 50% survival in 2 years. In lung transplantation, the survival is about 83 to 86% at 1 year, about 60 to 70% at 3 years, and from 50 to 60% at 5 years. Another way of looking at that is if you have 100 people who've had a lung transplant and you had a reunion in 1 year, about 83 to 86 people would show up. In 3 years, between 60 and 70 people would be able to show up, and in 5 years, between 50 and 60 people would show up. So you can see that we do the lung transplant when the patient's survival is 50% at 2 years, and a lung transplant survival is between 70 and 80% at 2 years.